Hi, my name is Tanya and this is my channel, Tea Talks 93. I received a couple weeks ago a message from my friend that showed an article about nurse burnout, and so I would like to talk about nurse burnout a little bit today. So, what is nurse burnout? Feelings of energy depletion and exhaustion, increased mental distance from one's job, and reduced professional efficacy. The 10 states, so these are statistics from 2024, just recent. 10 states with the most nurse burnout: Arizona, which is where I live in Arizona, New Jersey's number 2, Minnesota's number 3, Ohio's number 4, California's number 5, which kind of surprised me because they have a lot of rules in place where they watch how many breaks they take. They make you go to your breaks. They pay you well. They provide different resources if you're feeling nurse burnout or having some issues with depression or anxiety or things like that. They have professionals there that helps you. So that one surprised me a little. So if any of you have an idea why this might occur, please let me know on this channel. I would like to say that I can see it in the metro areas like LA. My friend that went and worked in LA, they appreciated the pay and they appreciated the breaks, but there was very difficult caseloads, and then they felt like the resources were not there. So if they needed certain tubings or certain needles or things like that, things weren't there for some reason. So that's very odd. So just tell me, why do you think that California has high nurse burnout rates? Texas is number 6, which surprises me too. I had another friend that was doing travel assignments in Texas, and maybe that's why, is because they're needing more travelers in these places, so that could be part of it. Let me know. Florida is number 7. I have heard like the wages are not so good in Florida. The area is beautiful. I've been there several times, so it really saddens me that Florida is on this list. Michigan is number 8, New York is number 9, and Illinois is number 10. So if anybody is from those areas, please let me know why you think that there's such a high nurse burnout rate there. Anyone that works in the nursing industry in these areas. So it talks about when nurses experience the highest burnout rates, which tends to be, it looks like, from November to 26th to December 2nd, which tends to be when influenza breakouts come, so that could be part of it, and the patient loads are very high. And then if you already are not having enough nurses, then you're putting more patient loads on there, and they're sicker. They're much sicker when they have these viruses that come out during the winter months. So the nurses reached the highest level of burnout in the last 5 years during the week of April 17th to 23rd in 2022. I have no idea why that would be. I'm not sure if that was a year that COVID was just very high, or if they had COVID, RSV, and influenza going around at the same time. That could be part of it. It seems like these three have really caused us to have a high patient load in the winter months. And then on average of the last 5 years, the month with the highest level of nurse burnout is November. And again, like I said, that's when influenza starts breaking out and people are getting super sick and requiring high levels of oxygen, and they get septic and they end up on life support and things like that. So it can be very stressful, especially if you're already suffering with not enough resources. Yep. So what is nurse burnout? So nurse burnout is a serious job-related condition, and this is directly from the article. It can have severe consequences to nurses because they don't have enough resources, and then our patients, because if you don't have enough resources to do your job, then patient outcomes are going to suffer. It's obvious, right? And if this continues to go, you get moral injury, because we're doing things to people that maybe they shouldn't be doing. Like if somebody is very ill and we're putting them on life support, even though it's the end of their life, then nurses can be disheartened from that and suffer moral injury. And the more these things go, the higher the risk of getting nurse burnout is. Um, so we talked about physical exhaustion, mental exhaustion. They start to distance themselves from their job, so maybe they're not as compassionate as they could be because they are suffering themselves. They can be cynical about a job, and to be honest, I hear a lot of cynicism in the nursing industry because they are suffering with people not listening or not a plan in place to combat this issue. So it's very concerning for not just the nurses, not just the hospitals, but for the community. And it would be great if we could find a way to prevent it before it's a problem. But it is a problem. Obviously, if there's 10 states that have high nurse burnout rates, then it is already a problem. What leads to burnout? Providing compassionate care, working long hours, changing shift schedules, being on your feet for hours at a time. I can tell you, I once worked a 12-hour shift, and I won't say what I was doing, but I worked a 12-hour shift, and I had a 8-ounce cup or little container of chocolate almond milk. That's all I had for the entire 12 hours because we were so busy running around that we could not even get our work done. We couldn't get our charting done. I was sitting after time charting, and I have been in this industry for 26 years, so it can be very difficult to get your job done. And then the more often this happens, you're going to get burned out. It just makes sense. Sometimes other colleagues are not compassionate towards you because maybe they're suffering, or maybe they just got yelled at, or maybe a patient's not treating them kindly. And it's hard to treat other people kindly when people are not treating you very well. Another thing that is happening is our baby boomers are retiring. So our number of people that need more care, that are more ill, that is going up. So that means we need more nurses, which we have a shortage of nurses. The younger generation, a lot of them aren't wanting to be nurses. They don't want to lift and tug and clean people up and do things that is back-breaking work, to be honest. Causes back strains, neck strains. Doctors will say, oh yeah, you have nurse's neck or you have nurse's back. How do I prevent it? I've already gone through the classes and I try to make sure that my body mechanics are correct, but I'm still getting these injuries. And then sometimes it feels like if you report that you got an injury, then people will think that you're just complaining and you should have done something to prevent it yourself. And sometimes you just don't have the extra help, or something happens and the patient maybe turn wrong or move wrong, and then you're injured and there's nothing you could have done about it. But it feels like you're being judged when you report things like that. I did speak about moral injury, and that's like a psychological wound when you take actions or witness actions that violate your moral beliefs. And again, when you have someone who is they're maybe getting ready to pass away, and then maybe families are arguing over should we let them go peacefully or should we keep them on life support, and you have your own belief about that, then sometimes that can cause moral injury, and then the more that happens, and so this would explain why in ICUs it's higher for nurse burnout than in the other units, because they see that more often. How to prevent nurse burnout: making sure you get adequate rest, and that doesn't just mean sleeping at night. You got to take your mind completely off your job. You can't take it home with you. If you take it home with you, it's just going to sit and simmer, and you're not going to be able to sleep, and then you're not going to be able to work because you're going to burn out really fast. But also during the day when you're at work, that's one thing that I was like so amazed that California was on the list, when they make sure that they have their 30-minute lunch breaks and their 15-minute breaks in between the 4-hour marks. And they make sure that they get them. They have somebody there to watch your patients so that you can go take them. And that doesn't happen everywhere, not in the United States, not in every single state. And also, there is a trend where people are, or managers or hospitals or whatever, are having nurses take classes or meetings or something during their lunch break. Lunch break, you should be able to step away from your workload and just decompress. You have to decompress. If you don't, then you're going to burn out. So I really hope that they see this, because I have had to sit through a learning lunch. I do not appreciate learning lunch, because that is the time I would rather step outside. They have proven time and time again that getting out into nature and things like that will help you mentally, so that you can come back refreshed and take care of your patients appropriately. Asking for help. If you have a place where you're working that when you ask for help, they're not giving you help, that will create burnout, because they won't be asking for help anymore. And then the patients also suffer if you're not getting help, right? So say you have a patient that is completely bed rest, and you need somebody to help you turn them, move them, change them, things like that, and you're trying to do it by yourself. That's going to stress you out, injure you, and potentially injure and stress out the patient. So that is not okay. Ask for help. You should be able to ask for help. And if you can't ask for help, then you need to go higher up and say, hey, I'm not getting the help. I've asked for help. What can we do to fix this? Because I need more help. So make sure to communicate those two. Getting exercise. And this is kind of where I admit that I fall short. I used to exercise every morning, but I have gotten not so good about that. So it is stress relieving. It improves your strength and cardiovascular fitness. That can make the physical demands and nursing less strenuous, which again, when I was talking about lifting and tugging the patients, if you are more physically fit, then it's less likely that you will have injuries. And eating well. Not just eating, but eating well. So eating healthy meals, staying in good shape with exercise, and then eating healthy meals, making sure you're getting enough healthy food during your shifts as well as after your shifts, before your shifts. And like I said before, I had a whole 12-hour shift where I had was a small amount of almond milk with chocolate, and that was it for a whole 12 hours. Kidney problems, that can cause kidney problems, especially if that continues to go on day after day. Eating junk food can cause you to have like that real high on the sugar or salt or whatever it is, and then that low if it is sugary. You'll have that let down. And then if you have any other questions or want to look at the articles that I was looking at and reviewing, you can go to betternurse.org or visit Healthy Nurse, Healthy Nation site for more wellness tips and resources. Thank you for listening, and please share your opinions. I'm more than happy to listen to them and talk about them. Thank you.